the Orinoco River has flooded. But while some locals fish from the river, others in the city of Puerto Ayacucho in Venezuela's Amazonas state are having trouble getting enough food. Dr. Elvis Aragua works at the main hospital in Amazonas. Areas where patients are supposed to be treated are contaminated, and there are few supplies. These facilities are supposed to accommodate indigenous populations from remote communities, but now they're empty. More than 50 children died of malnutrition here in the last few months, in the midst of a national nursing strike. The hospital is no longer safe for indigenous people.
There were even more fatalities that were not reported, maybe out of fear of the World Health Organization. But it's good that this situation has now been publicized worldwide.
The chief of the Piapoco ethnic minority has called a town meeting. Dr. Aragua has met with an indigenous organization to treat the local children and deliver medicine. The number of children dying of malnutrition has increased in rural areas, where malaria and measles outbreaks have recurred. One boy from the Piaroa ethnic group was hospitalized until a few days ago, until his grandparents took him home. Octavio Castro is the chief of Caño Grulla, where malaria is widespread. More than half the community works in illegal mining operations. They've neglected traditional agriculture.
We're trying to plant something for the sake of the children. There are problems because shamans cannot heal these diseases.
Maria Eugenia Grillet, a Venezuelan researcher, blames the resurgence of malaria on the boom in illegal mining throughout southern Orinoco. The deforestation and ditches filled with stagnant water lead to the spread of mosquitoes that carry the disease. Grillet is calling for joint efforts with international organizations to fight the epidemic.
The Health Ministry should collaborate with the Pan-American Health Organization and various health-related NGOs in Venezuela, along with academies and international groups like Doctors Without Borders, because they know exactly how to tackle a problem at its current level. We have an epidemic that's out of control.
Hunger, epidemics, and the economic crisis are bearing down on the children of Amazonas state. The future of Venezuela's indigenous populations is under threat.